Hi, I'm Eric Mansfield. I'm a licensed clinical social worker, and welcome to Practical Mental Health. So today, I'm gonna, this video is titled, What is Therapy, Part 2. When I was reviewing Part 1, I realized I kind of left out some stuff. So in this video, I want to kind of clarify a few things that therapy is a process. So from the moment that you call the office or try to contact a therapist, whoever it might be, depending on who they are, especially if insurance is involved, there is going to be a process, hopefully to your healing. But there is a process. So let's say, for instance, you are coming to the company that I work for. There are going to be legal documents. There's going to be a lot of paperwork initially. And I don't want to scare you off with that. I mean, there's legal documents that helps protect the company from liability issues and all that stuff. But at the same time, there are other forms of paperwork that we have to do, especially with regards to assessment, comprehensive assessment, making sure that we have ISPs and our individualized service plans, which is basically a list of your treatment goals, what you want to accomplish. We have to have all those in place to satisfy insurance companies and the credentialing agencies. So sometimes it might take a session or two in order to be able to do that, but that's all part of the process. So once you actually do get into the office and you're sitting in front of a therapist, like me, for instance, we do an assessment. And basically that's a biopsychosocial spiritual assessment. So we're basically assessing, what's going on with you biologically, what's going on with you psychologically, socially. Do you have strong social supports? Do you have friends, family? Are you getting out, or are you a loner, introvert as opposed to extrovert? The spiritual aspect, that definitely has a lot to do with everything. I mean, your belief system with regards to whether you believe in God or not. If you're atheist, agnostic, to me, it doesn't matter. Right now, I'm seeing people across the board, a whole bunch of different, ideologies and whatnot. But the idea is like trying to figure out what is actually going on with you with regards to symptoms. And I focus on symptoms, not labels. So even though in the assessment and with regards to insurance companies and credentialing agencies, I have to give a diagnosis. I have to put that label on paper, but I'm not labeling you. I don't want you to feel labeled or anything to that effect. It's just all part of the process. Okay, so once you're in and we do the assessment, then we're going to explore goals for treatment. Like, what are you there for? What do you hope to accomplish? Sometimes people struggle with really identifying what their goals are. And oftentimes, the basic go-tos, if people like kind of throw their hands up and go, I really don't know. That could be anything from learning how to manage depression, anxiety, anger management, stress management. There's just a whole slew of communication skills, relationship skills, any number of things. Those are just a few of the things off the top of my head that seem to be pretty common. Trauma reprocessing, that's definitely a big one there. So once we explore your goals and we identify the goals for treatment, what I tend to do is I try to stick to those goals. Sometimes, I think I might have mentioned it in part 1 about the crisis of the week. People will come in and we kind of get diverted with regards to not really focusing on the goals as opposed to what's going on that week. Oftentimes, it could be related to if your goal is depression or anxiety, or managing depression and anxiety or anger. Whatever the crisis of the week is might tie into that. So that's kind of why, I do the things that I do with regards to like setting general goals. So that way, as life happens and people experience life, they can bring problem issues and we can work through it in that way. What I tend to do a lot is educate people about what they're experiencing. Oftentimes people will feel a certain way and they don't understand it. I have actually heard of people saying like, yeah, I know what anxiety is. I feel anxiety, but I really don't understand what it is. Why is it happening to me? What is going on? And I'll educate my clients about that in general. I mean, I don't get down to the nitty gritty and, break apart the brain. I don't even bring out a model and show people, oh, well, this is the part of the brain that does this and does that. I really don't see any point to that. However, it does help for them to understand and know what might be the general cause, why they're feeling a certain way. So one of the things that I tend to do is try to help them to identify what are their thoughts, their feelings, their behaviors, and how all that is tied to the symptoms and how their symptoms are tied to their thoughts, feelings, and behaviors. I try to help people identify what might be useful coping strategies. Everybody's different. No two people are alike, and there's no one thing that works for everybody across the board. So I have my toolbox of coping skills and strategies, and I try to help clients identify, okay, out of all of these tools, which ones, not just one, plural, more than one, hopefully, which tools work for you. And hopefully we can identify more than just one coping strategy and one skill. So a lot of that has to do with really getting into self-exploration. So I really try to help clients identify what their strengths and limitations are. And I say limitations because I don't want to use the term weakness. Weakness, that's just, you get into the whole languaging thing and the energy that comes about that. Weakness seems to have a very negative kind of connotation, if that's the right word. Has a negative aura about it. I don't know how else to explain it. So I usually refer to it as strengths and limitations, because sometimes you might be limited in something. It doesn't necessarily mean that you're weak in that. It just means that, you might have some limitations, and there's varying degrees of limitations. So being able to understand yourself through self-exploration, building on your strengths, shoring up limitations, maybe even strengthening limitations, or trying to figure out how to work around them, if it's something that you really, really do struggle with. I tend to explore lifestyle habits. A lot of people don't seem to realize there are certain habits that, it has a huge impact on your mental health. Sleep, that would be a habit that, people know that they have to sleep. However, do you understand that you have to have a sleep routine? You have to have the sleep hygiene, like not sleep cleanliness. It's just hygiene as far as like how you prepare yourself for bed. What is the environment that you're in? Is it the right temperature? Do you prefer a hard surface, soft surface? What is the sleeping environment? And especially the time factor. I have had so many people that their habit was just random. So the idea is one night they may go to bed at 10 o'clock p.m. and toss and turn and not fall asleep until 1 or 2, but then get up at 6 o'clock in the morning, and then they're tired all day long. But then even though they're tired, they stay up and maybe won't go to bed until 1 or 2 in the morning. And then again, get up at 6 o'clock and then complain about being tired all the time. But then they may try to go to bed at 9 or 10. Because they're exhausted, they may fall asleep at that point and then actually get a good night's sleep. But then they feel refreshed, and then what do? They go back to not going to bed until 1 or 2 or whatever time. And I've seen people who are like just all over the board. I've had clients that told me that one night they'd go to bed at 9 o'clock and sleep a few hours, and then The next night it was 12 a.m. Then some of them say, they don't go to bed until 3 o'clock in the morning, and then it's just all over the place. So the idea of exploring lifestyle habits is trying to figure out, okay, what are your habits? What is actually affecting your mood? And your mood is going to affect your thoughts and behaviors. And how is this affecting you overall? Sleep patterns in particular, that's like really one of the primary things that I tend to focus on. If you are not getting good sleep, you're probably going to struggle with a good mood. So having said that, then the question is, are there needed changes? And then I tend to kind of get into problem solving and exploring, like, okay, what changes need to be made? Are you capable of setting a bedtime and a wake time every single day to include weekends? No more sleeping in, no more hitting the snooze button. Can you do this? I've actually had clients who said, no, they can't. And I'm like, okay, well, I don't know what to do with that other than continue to encourage you to try to do it. But okay, we need to switch it up. And if you're not going to try to get good sleep, then we need to figure out some other coping skills to maybe help you manage being tired all day long. And caffeine is not the answer. So it can be helpful, but it's not the answer. So, and I kind of wonder if there really is an answer for how do you really cope with just being tired, other than just accepting it, and it is what it is, and this is your lifestyle, and if you're comfortable with that, great. That's how you're going to live your life. It's how you choose to live your life. If that's not how you want to live your life, then yeah, you're going to have to make some changes, whether you want to or not. So that's all part of like exploring the lifestyle habits. Are there needed changes, and trying to help clients identify what those are. I don't have a magic wand. I don't have powers and ability to force people to do things that they should be doing. You have to make that decision for yourself. So if you do identify the changes that are needed, you identify coping skills that can be helpful for managing your symptoms, then you have to put those things into practice. And that's going to be like mindfulness, practicing mindfulness, problem solving, your coping skills. Coping skills might be emotion regulation. You can do, practicing communication skills, relationship skills, adjusting your life habits, replacing old habits with new habits. The list just goes on as far as like what you can learn in therapy to be able to put into practice in your everyday life. And that's one of the reasons why I call this channel Practical Mental Health, is what can you use in your everyday life to help improve your quality of life? That's really what it's all about. That's what I'm really all about, is I want to help people improve their quality of life. But you have to do that for yourself. I've had clients come to me and thank me for helping them, but anytime anybody does that, I tell them, pat yourself on the back, because you did it. You actually made the effort to improve the quality of your life. All I did was give you a direction. You decided to follow the directions. So all of this is designed to help clients, change patterns of thoughts, emotions, behaviors for better outcomes, better life experience, better quality of life. All that. That's kind of the goal, I think, and I would hope for most therapists, if not all therapists. I know that's my goal, but that's my goal, not imposing it on clients. The other thing too is, I'm not sure if I mentioned it in the last video, but therapy doesn't last forever, and it's not supposed to. It's basically trying to identify what is the problem area, what are the potential solutions, trying to identify what are the solutions to the problems, and then putting those solutions into practice and then hopefully the outcomes will be beneficial. And if you can sustain that, then you probably don't need to keep coming to therapy. I tell people, not all the time, but it is something that I tend to convey to people. I look forward to my clients saying, Eric, I don't need you anymore. I mean, how many professions do you look forward to? I mean, yeah, who actually says that? Me. I don't know if anybody else does or not. I want people to heal. And once they're healed, not that I want them to go away or anything like that, but like, if they don't need to come to services anymore, that's what makes me happy, because it makes me feel like I did my job, and I hope I did it well. However, having said that, therapy can last forever if you want it. It can last your entire life. I mean, if you're willing to pay for it, and depending on what your goals are, there are some people that they just need that one person to be able to come to be able to vent and unload whatever is on their mind, on their, just get stuff off their chest, and doing it in a safe space that they know that the therapist is not going to go reporting what they said to their family members or anybody else. What happens in therapy stays in therapy. That's the general concept for that. So it's up to the client. But yeah, so I hope that kind of clears some things up about what therapy is, outside of part one. If you haven't seen part one, go back, watch, listen, learn from that. I might have repeated myself, and that's something that you'll hear me probably do on a frequent basis. But me repeating myself, look at it as memory reinforcement. I do it in therapy, and I'm going to do it probably on these videos, because there are some things that need to be repeated and memory needs to be reinforced. All right, having said that, I hope you have a wonderful day. I wish for you a wonderful life, and I love you all. It's a brotherly love. Take care.